Today we are going to see about the acetaminophen, that is paracetamol. So the action of acetaminophen, that is paracetamol, is it blocks the pain impulses which is generated in the peripheral area that occurs in the response to inhibitions of prostaglandin synthesis. And basically now there is a myth of acetaminophen that it is work as an anti-inflammatory drug, but it does not possess anti-inflammatory drug properties. And it is also used in antipyretic action results from inhibitions of prostaglandin in the CNS. So basically, a hypothalamic heat regulation center. Coming to the uses of that, it is like your acetaminophen is used as a mild to moderate pain or a fever, and don't get confused in aspirin and acentree and all thing, uh, because mostly it is like in normal layman words, like acetaminophen is called as aspirin or aspirin 3 and acin. Mostly they are confused in this. It is also used in dental pain and dysmenorrhea. So what it is basically, it is a menstrual cramp. So for this purpose also acetaminophen is used. Myalgia, wherein muscle pain, osteoarthritis, which is a very down of cartilage or in joint. Basically it is mostly seen in the in the elder age, like to say old age, and erythralgia, wherein it is a pain in joint. So hope you are cleared with the action and the uses. Coming to the dose part, here wherein I have not written in the page, so it is like it is in the form of suppository, soft chew tablet with the caps, and even in the oral, and even in a IV. It is in liquid form also, in a oral drop form also. So guys, the side effects of the acetaminophen is hepatotoxicity, renal failure, and urticaria, wherein there will be, if the patient or the person who is taking, if he is having any kind of allergy or some he is not getting, like it is not suiting to him, then he will be having rashes in the skin, anemia, neutropenia, and jaundice. Let's see the pharmacokinetics. So 80 to 90% metabolized by liver, and because of that reasons it is metabolized in liver. Because of that reason, as a health educations or as a nursing responsibility, we need to check the liver function test. Liver function test. Coming to the next, it is excreted by the kidney. So even for as a nursing consideration, we have to check the kidney. If any in findings there is blood, then it means there is a nephritis is formed. If it in the like in we have to check a renal function test. So it is like in kidney we can check the creatinine level, and urea, and one more is bun. So guys, not only the blood but also albumin, if this both content is seen, there is a presence, so it is like nephritis is there. Metabolized may be toxic if overdose occur, widely distributed. And it also cross placenta, the main highlighted point over here, it also cross the placenta in low concentration form. So basically if any pregnancy women is there, contraindications guys, just don't like tell or educate them, don't take any opioid, like it is an analgesic kind thing, so don't take it. And it is excreted in the breast milk also. I have done a little bit of mistake, I have not written yes over here. And the other thing, Other part is the half life, that is half life of this acetaminophen is 1 to 4 hour. As I've already informed what is half life, the time it takes for amount of drug active substance in your body to reduce. And in a simpler way I can tell to determine for like why we need to know this, because we have to like to determine the excretion rate. Coming to the other is in oral form the onset. What is onset? It is like in a Hindi we can say it like a shuruat or starting point, where in 10 to 30 it is 10 to 30 minutes, and the peak point like it is the highest levels of medication is present in the blood, so it is like half to 2 hour, and the duration will be 4 to 6 hour. And if you are taking acetaminophen in the form of IV, then the peak level will be guys 30 to 120 minutes. If it is in the form of suppository like rectal suppository, the onset is slow and the peak is 1 to 2 hour, and the duration is for 4 to 6 hour. Absorptions varies according to the person, like it varies. And I hope this is clear little bit. I have guys missed one thing in this, that is acetaminophen is like the chemical class of this is a non salicylate. Salicylate. It is non salicylate. And the function classes is it is a non opioid analgesic as well as an antipyretic. So for acetaminophen guys you have to remember N and A. N for non opioid analgesic, you can tell it like analgesic, but if you will tell non opioid so it will be very good. And the other thing is antipyretics. So by this word you will get to know it is working for an fever as well as for pain. So thank you so much for attending. Hope this is helpful for you.